Hello, I'm Dr. Hilary Jones, and I'm pleased to say that I'll be working with your co-op pharmacy to help and support with lots of healthcare matters that might crop up. Now, I know that it can be very anxiety-making to begin with when somebody first notices that they're experiencing hair loss. Some people just accept it as part of their biological makeup and part of nature and the aging process. Other people really want to treat its underlying causes. They want to put it right for either medical or cosmetic reasons. Of course, it can affect both men and women. And for various reasons, some causes of hair loss are treatable and others not so. But topical treatments which we put on our heads, on our scalps, need to be used regularly and for a long time. And there's a whole range of things which can lead to hair loss, which I'll go through now. First of all, there's male and female pattern baldness. And this type of hair loss usually runs in the family and is the leading cause of permanent hair loss, unless it's treated, of course. Iron deficiency is a leading cause as well. But people who lose weight through dieting quickly can experience hair loss. Cancer treatments, of course, chemotherapy is well known to cause hair loss, which can recover quite spontaneously and naturally. Certain medications can be responsible. And then there are autoimmune diseases where you make antibodies for unknown reason in your blood, which attack the hair follicles and lead to hair loss. Stress and illness, each of these can cause temporary hair loss. Childbirth, because of its effect on the body. It's a bit of a shock to the body, and many women after childbirth can experience quite a bit of hair loss for a few months. A low protein and calorie restricted diet, we've touched on rapid weight loss. That's another factor. Certain hairstyles and procedures such as cornrows, braiding, and extensions, they can pull on the hair and cause something called traction alopecia. So hairstyles and procedures, and vitamin B12 deficiency as well. The good news is that there are treatments which exist for both men and women for male and female pattern baldness, which we'll talk about in a moment. Let's talk about the hair loss that we see in men. Well, the average scalp is covered with about 100,000 hair follicles, and we lose somewhere between 50 and 100 of these every single day. Many will regrow hair, of course, but we tend to notice hair loss when we lose more than we're regrowing. And some people have more hair loss, of course, than others. And it can be accelerated by medications, by poor nutrition, poor diet, by severe stress. But of course, the most common reason of all is male pattern baldness, hereditary hair loss. This accounts for about 95% of all hair loss in men. Well, male pattern baldness, which is also known as androgenic alopecia, is due to your family genetics. What happens is that a byproduct of testosterone, the male hormone in your body, this dihydrotestosterone causes the follicles, the hair follicles on your scalp to shrink and to shorten their lifespan, basically. It's the cause of 95% of all hair loss in men, the most common. And 40% of men will experience some degree of hair loss, noticeable hair loss, by the age of 35. Another good statistic is that 50% of men by the age of 50 will have lost 50% of their hair. So it's not something that is uncommon at all. Hereditary hair loss can come either from your mother's side of the family or your father's side of the family. And it tends to follow two predictable courses. Either you notice that your hairline is receding, or you notice that the hair on the crown is becoming very thin. But the important fact to realize is that the earlier you start treatment for hereditary hair loss, the better your chances of seeing good results and some recovery of that hair loss. So what treatments are available for male pattern baldness? Well, there's no cure as such for it, but there are treatments which can at least slow down the hair loss and sometimes regrow some of the hair that's already been lost. This works in about 66% of men, according to well-publicized clinical trials. Now, there's no guarantee that treatments will work, but often the results are very good and very satisfying. Treatments with the strongest supporting evidence of all are the prescription medication finasteride and the over-the-counter medication Minoxidil, which is sold over the counter as Regain. That's the brand name, Regain. Now, Minoxidil Regain is the only clinically proven over-the-counter treatment for hair loss. It can stop and reverse some of that hair loss. Regain contains minoxidil, that's the generic name for the medication, and it contains the only over-the-counter active ingredient that's clinically proven, as I say, to help stop or even reverse hair loss. It works by doing this. It increases the blood flow around the hair follicle itself, and it stimulates follicle movement into the growth phase. And not only does it do that, but it extends that growth phase in the course of time. When it's used twice a day, you'll see that you probably have visibly more hair in about 16 weeks. So it's not a short course. That's 4 months that it'll take to see some improvement in most men. And you may think that's a long time, but when you think how slowly hair grows, it's not surprising. You might notice some hair shedding from the second week, but that shedding process shouldn't last more than 2 weeks. And if it does persist for longer, then seek medical advice. If you stop using the product, the hair that you've regrown could revert back to where it was before. So it's important that you continue with this treatment indefinitely. Now, finasteride is a prescription-only treatment that is available from Co-op Pharmacy's online doctor service. It's used for male pattern baldness, also known as androgenic alopecia. It's due to family genetics, and it's the byproduct of testosterone, something called dihydrotestosterone, or DHT, which causes the follicles to shrink and to shorten their lifespan. Finasteride works by preventing the creation of DHT, that byproduct of testosterone, and therefore it prevents that from affecting the hair follicles. Treatment is usually a once-a-day tablet, and it can take between 3 and 6 months to start producing noticeable results. So you have to be patient. And you've got to continue with that finasteride to maintain the results that you get. When should somebody seek medical help for hair loss? Well, if you develop bald patches, this isn't part of male or female pattern baldness. This is something else. So there could be medical reasons for that. It could be a condition like psoriasis, could be a condition such as an autoimmune disease where you make antibodies against your hair follicles. So that's the reason, bald patches. What if you're losing your hair in clumps? Similarly, it's not a generalized hair loss or male pattern or female pattern. It's different. See a doctor about that. If your head itches and burns, something's going on with the skin there. That's not normal as part of hair loss. But if you're generally worried about your hair loss, even if it's for cosmetic reasons, if you think that you might have iron deficiency, a thyroid problem, go and talk to your doctor, because sometimes a simple blood test may be all that you need to find out the cause and find an easy solution to the problem. There are many reasons why women might experience hair loss. And of course, it's particularly distressing for women, especially if they're young. And the American Academy of Dermatology, in fact, reports that 40% of women will have noticeable hair loss by the age of 50. So if you are experiencing hair loss, you're certainly not alone. And it's worth discussing it with your pharmacist or with your doctor. The sort of causes that we're talking about will be just getting a little older, diminishing youth, as I like to call it. And of course, the menopause has a major effect because of the change in hormone levels. Genetics plays a part. So there's female pattern baldness, which is something that can run in the family. Hormone imbalances I've mentioned, so we can see changes either in the menopause or during childbirth or after childbirth. Polycystic ovarian syndrome, which is not uncommon. This produces more testosterone in the body, and that has an effect, as it does in men, to reduce the health of the hair follicles. An underactive or an overactive thyroid can be responsible. So can a poor diet. And certain cancer treatments, of course. Chemotherapy is well known to produce temporary hair loss, which sometimes grows back quite vigorously. But nevertheless, you lose hair in the first place. And then stress and trauma generally can have an effect. So it's more common for women to lose hair, for example, in the few months after giving birth, as I've said. Now, it's believed that female pattern baldness, also known as androgenetic alopecia, is caused by the action of a byproduct of testosterone called dihydrotestosterone on the hair follicles in the scalp. Now, although we know testosterone as being the male hormone, it is also present in smaller quantities in all women. And some women are more prone to the effects of this dihydrotestosterone than others. And the hair follicles shrink and go into a resting phase more often and significantly than they would otherwise. So female pattern baldness and hair loss is an inherited condition, and it reduces the time that the hair spends in the growth phase. The hairs become thinner and smaller, and they also become lighter, less dark. So that's one of the reasons why the hair loss becomes more visibly noticeable. Another factor is stress and diet and hormone imbalances. We've talked about this. The hair goes into the resting phase and can be shed over the whole of the scalp. So it's a generalized hair loss. An underactive thyroid can do something similar. Alopecia areata is a form of autoimmune disease where your body, for some reason, makes antibodies to your own hair follicles and destroys them. So it happens in patches, not generalized across the scalp. And often women report their hair coming out in clumps. It may last just a few months and spontaneously recover, but sometimes it's progressive. The treatment involves corticosteroid injections from a specialist, but thankfully the condition is not extremely common. Overstyling can cause hair loss in women. So treatments such as cornrowing, extensions, braiding, tight curling, all of these things can create physical trauma to the hair follicles, and hair loss can happen as a result. So just be careful if you've got vulnerable and brittle hair not to undergo those kind of treatments, because they could do more harm than you might otherwise anticipate. So it's worth thinking about regain if you've got female pattern baldness, hereditary hair loss. So if you're losing your hair, regain is worth considering. It is the brand name for a medication called Minoxidil, and it's scientifically proven that the active ingredient Minoxidil can help to stop further hair loss and even help you to regrow some of the hair that you've lost already. It tends to reactivate the hair follicles and helps to promote fuller, stronger, and more voluminous hair. So you will increase the blood flow around the follicles, taking regain, stimulate follicle movement into the growth phase, and extend each follicle's growth phase as a result. Let's talk briefly about Minoxidil, otherwise known as Regain. Regain for Women foam is clinically proven to regrow hair in 8 out of 10 women, which is a good ratio. It's the only clinically proven foam to regrow hair. Results won't happen overnight, of course, but what you will see is clinically viable hair regrowth within about 12 weeks. Shedding of hair may occur anywhere between 2 weeks and 6 weeks, but that shedding process shouldn't normally last more than 2 weeks. And if it does, it's best to go and get some medical advice on that. If you stop using the product, you'll lose the hair that grew back, and you'll most likely revert to the previous pattern of hair loss. So it's something that needs to be continued indefinitely. And there are also a number, of course, of cosmetic treatments and shampoos that aim to thicken the hair shaft, albeit temporarily, but they're worth trying. And of course, talk to your hairdresser as well for further cosmetic tips.